There isn't much evidence as regards bilingualism in Down syndrome. However, the aim of this video is to explore and try to make clear certain beliefs on the acquisition of a second language. Down syndrome is a condition in which a child is born with an extra copy of their 21st chromosome. This causes physical and mental developmental delays and disabilities. Children with Down syndrome present language deficits in non-linguistic domains, and their language development lags behind that of typically developing children. Research on bilingual children with Down syndrome is limited, but has shown that second language learning from an early age has no impact on their first language development.
Previous studies have shown that children with Down syndrome produce their first words at a much later age than children with typical development users of two languages, and that the level of their first language is not affected by the learning of the second. Although further research studies point out that bilingual children with Down syndrome present a delay in their language development, especially in the morphosyntactic language domain, they do not consider bilingualism the main cause for this delay. Speech intelligibility, speech that can be easily understood, is one of the most difficult areas for people with Down syndrome at all ages. Factors that can contribute to speech intelligibility problems include articulation problems with specific sounds, low oral facial muscle tone, difficulty with sensory processing and oral tactile feedback, use of phonological processes, for example, leaving off final sounding words, and difficulties in motor planning for speech.
Children with Down syndrome have strengths in the area of vocabulary and pragmatics. Syntax and morphology are more difficult areas, possibly because of their complex and abstract nature. Children with Down syndrome frequently have difficulty with grammar, tenses, and word endings, and use shorter sentences to communicate. Most children are able to understand much more than they can express. As a result, their test scores for receptive language are higher than for expressive language. This is known as the receptive-expressive gap. Children with Down syndrome are expected to show cognitive delay, to be slower in developing their awareness and understanding of the world, and to think, reason, and remember. This cognitive delay may be in part the consequence of the language learning difficulties. Any serious language delay will inevitably result in increasing cognitive delay, as language is such a powerful tool for gaining knowledge and for understanding, thinking, reasoning, and remembering. Conversely, the more we can do to overcome the children's language learning and speech difficulties, then the better equipped they will be to learn and improve their cognitive abilities. Children with Down syndrome learn well through visual means, so often reading and the use of computer programs focusing on language skills can help them learn. Seeing words and images associated with sounds and being able to read words can help speech and language development. The motivation of our choice comes from our experience teaching children with Down syndrome.
In 2019, I had the opportunity to do my practice in Escuela de Apoyo a la Inclusión número 2, in which I worked with children with a variety of disabilities, mainly with Down syndrome. It was the most significant experience in my life, since for the first time I was faced with students who could not speak, write, or express themselves easily. Therefore, the teaching and the work was not the same as we provide in other schools. I had to learn how to work with them and use this variety of pedagogical implication to apply in classroom, such as total physical response and visual aids. Now I want to show some activities that I did with my students. The first one was teaching animals in the classroom. Students had to represent the sounds of animals and their movements with their body. As teacher, I had to demonstrate through flashcards, videos, the animals by producing certain facial expressions or mimes to indicate its meaning. As regard listening, students had to close their eyes in order to recognize the animals through sounds. Then say the name of the animals or out loud. The second one was teaching action words. Students and I had to self-perform gestures accompanying words and phrases. Enhance vocabulary retention compared to reading or listening. The procedural memory was automatically involved when students accompany words with movement. We play games like Simon Says, mentioning and performing common verbs like jump, sleep, eat, and drink. And the last one was teaching vocabulary related to colors and feelings through songs. The explicit use of gestures helped learners not only with the meaning of words, but also to retain the phonological form of words. Students could listen to the word and represented it through gestures or repetition. Through practice, learners could benefit from enactment as they successfully acquire novel vocabulary.
According to the results shown in Bilingualism in Down Syndrome, a Greek study, there is a highly positive correlation between articulation and oral vocabulary and receptive vocabulary and picture vocabulary. In relation to the receptive and productive system, there is evidence that bilingual and monolingual children with Down syndrome have statistically significantly better performance in the receptive system than the productive system. According to the results, there is a statistically significant positive correlation between articulation and oral vocabulary in the productive language system, which can be explained by the fact that articulation is the basic precondition for accurate oral expression. These findings point out that children with Down syndrome can become capable users of two languages, and that the development of their first language is not affected by the learning of the second.